Well, thank you so much, and we are coming to you from Pearl Marina here in Garuga, Katavi Town Council, Wakiso District. It's a beautiful morning, and we will be speaking matters humanitarian support. As we know, many elderly people that are in different communities are still suffering, among others, lack of access to health care, and the rest that, of course, comes with that. And partly government has also tried to support these people with all the special needs they need, they want to have, but not enough. Many of them are not cared for. But as we speak, of course, many other people come out with good hearts to project and extend some of the services that they need. Currently, there is an organization that is coming on board to also extend some of the support, the care, and some of the services that they will be, or they require in their daily lives. I am joined by the CEO of Kirungi Oita Foundation, and Kirungi herself, who is also a nurse by profession and is one of the people that are thinking well for this category of people. And she joins me on morning at Entebbe. Kirungi, Enidreda, thank you so much for joining me on morning at Entebbe.
Good morning, Ivan. Thank you for having me.
We understand you're part of the people, or you are one of the people that are trying to extend or try to have a service that cares for these elderly people in the country. And we know many of them still face a lot of challenges, including access to health care. Talk to us about Kirungi Oita Foundation and what it is intending to do for the elderly persons.
Okay. Yes, you are very right. Now, Kirungi Oita Foundation has a project. It's called Geavoj. It's a very strange name, but it is out of the language which is called Esperanto, and it means grandparents, grandma, and grandpa.
Okay.
We chose this name specific to address also expats and diaspora Ugandans, besides of, for sure, local elderly people. So the project in general is going to be based in Garuga. It's a pilot project. Now, it's about having access to specific medication, to specific items which are for elderly. Now, the challenges are for everyone, they're actually the same. Now, if you imagine the expats which are already in the country, and they consider this as their home because Uganda is beautiful and it feels home, they decided to retire here and to live here until God takes them.
But just before that, the challenges with the elderly people, I know I've partly covered my grandmother and the rest of access to health care and the rest that come with that. They need care.
They need care.
Then everything like that. So how big is this problem you see in the country that you partly want to address?
Now, we do not have actually any geriatric center at all in the entire country. We only have one geriatrician doctor, Dr. Sonko, which is also going to be having some interventions in our project. And basically said, elderly people don't have access to care which is supposed to be for their sicknesses. Coming, dementia, coming in, high blood pressure, diabetes, chronic diseases. They lack nutritious food. Some people are lonely because, like you and me, we work in the cities. Now, you're probably like your grandparents are in the village. They are alone. What happens if they fall sick? Who will take care? Most of the
You will have to drive from Kampala to go back to Manaf, where I come from, to take my grandmother to the hospital.
Yes.
Okay.
And now they are old. Sometimes they have even broken their hips. How are you going to manage? How are they going to manage? So it's better that we as a country, we as Geavoj, we have access to them. But that requires that we do proper education. That means we have to start getting geriatric nurses and doctors in this country to teach and learn them how to really take care of the elderly. And from there on, we pass the knowledge and education to the VHTs, which are the community workers.
And that's what I was going to ask. How are you going to reach out to these people? Are you going to collect them in one or single home? Are you going to go village per village, or having people who are making outreach programs? How are you going to reach out to them? How are they going to receive these services?
Yes. Now, how I said, the pilot project is going to be in Garuga. That means here is going to be a geriatric competence center. That means the base is here. But now we are going to be connected to all rural areas. That means after training, after having the VHT, they'll train from here, then go back to whichever location there are, cities or villages, and they will be connected to the LCs, LC1, from every location, and we'll have like a partnership where when we have cases which are really like severe or major, our basic team will go down or up.
So what is going to be, okay, in the facility, I can bring my grandmother. If I'm working in Kampala, I can bring my grandmother to Garuga. That's where the home is going to be.
Not a home, a geriatric competence center. That means we have a geriatrician, we have nurses. If you have eye problems, which are specific for elderly, dentists, everything will be here. It's like a hospital for the elderly. Yes.
So, how are people going to, are they services for pay? Are they for, please, because we want our audience to understand properly.
For sure.
Yes.
Yes, now the services are going to be for pay, for sure, because we want our nurses and doctors to be well paid. And still, always when you have some profit, as an NGO, we give it back to the community. That means the services which we are going to provide for the VHTs, the training will be free of charge, and also for the local communities who cannot afford, it will be free of charge.
And we know that government has partnered to try to support the elderly people who are, they're given some little money to support them through. But also, see, what do you think needs to be done to have these people cared for properly, to have a proper database of when we know which community has people maybe with the diabetes, blood pressure, so that we know properly how the planning can be for them.
Now, as a competence center, for sure we're having our IT sections where we're going to put a database for every patient which is required. So that means it starts actually, let's make an example. You have your grandma in the village. Which village are you?
I come from Manafa. That's my village in Butmanai. That's my village. I mean, the district and sub-county is Kato. So
now from there, if something happens, that means that you need necessarily her to have medical care, right? She is not going to go in a public means and come to Garuga. So that means she'll probably report to her neighbors, the neighbors either to the LC or to the VHT. They'll have our contacts. Then they'll call like our center and say, we have Madam
so and so.
Ivan's mother or grandmother with us, and she needs care. She has fallen down, she's bleeding, she broke something, and she has hypertension. What can we do? Then we check if we have her medical records. We go through her medical records and we see, oh, she has this and this medication, she has other diseases. Then we advise her accordingly. Do this, go there, kindly put a wound there, how serious it is, do blood pressure, and give us the feedback.
So if my mother is brought to the center, I can still have access to her.
Yes.
I can come share with her a meal, maybe if it's a Saturday, or how is it going to be then?
Yes. Now, the residents, which we're also going to have, are based on three things. You can bring your mother, let's say like you're traveling, and you don't want her to be alone.
Yes.
You can book in our facility, you rent it for a week or a month, or you're maybe abroad for 6 months, it's also possible. Then when you come back, you visit her, you take her out. We are going to have a cinema there, we're going to have a spa, a swimming pool. You can be within in the restaurant.
So that means that will be like the usual home. Whatever happens, it's like a normal home.
It's like having your own standalone home.
And somebody has to care for your mother.
Yes.
In there.
Yes, but medical care as well.
And
professional medical care.
And when they get fine, maybe they came sick, and after some certain period of time, they are maybe now okay. You can either decide to take your mother back home, or she stays around.
Maybe she'll love it so much that she wants to stay with us.
Okay, maybe your last words before we go to the audience, and how you think this should be perceived as something very serious, and speak to the audience.
Yes, so this is going to be the first Geriatric Competence Center in Uganda, probably in the higher East Africa. We are addressing expats and diasporans as well as local Ugandans. Elderly, starting age is 65 years above. Whenever you have a serious condition, might be chronic, it might also be that you have cancer and you are abroad and you want to come back home, please kindly feel welcome to be at our place and also have access to our services. Now, what's the difference? The difference is I come from Switzerland. That means I'm bringing Swiss healthcare system to Switzerland.
Yes.
Everything is going to be based according to my education and to my team, which is going to be from Switzerland. So you're going to find Swiss healthcare system within Uganda. For diasporans, please come back home.
And you also tell us, is the access going to be digital as well? Maybe some people can already log in and find out what is exactly going to happen.
Yes, we have a website which is running and we are updating it all the time. And the location will be, how I said, in Garuga, and everything you'll find online in these days.
Okay, Enidreda Kirungi, I want to thank you for the time you have spared to speak to us this beautiful morning on Entebbe.
Thank you for having me.
We also hope to get the services. I will personally bring my mother to also enjoy part of these services.
That's great. And in 10 to 20 years, I'll see you at my
Well, thank you so much. Of course, Enidreda Kirungi just speaking to us about the care for the elderly that still remains a raw and virgin service in the country, but from the projections that she's been able to tell us, we hope that this will as well be perceived and welcomed by the people in Garuga who are going to have it for the first time, and we hope everything will go on. But now, for time reasons, we want to let the conversation get back to the studios. A very good morning to you, our audience.